Hi, this is your friend and homeopath, Dr. Sujata Naik. Today is World Liver Day. The liver, which is one of the most important of the five organs in the human body, plays a major role in fat absorption and fat metabolism. However, when it loses this ability, that's when the fatty liver starts building up. Of fatty liver, there are two main types. One is the alcoholic fatty liver, which we know of, and that can be only cured through de addiction. However, there is another type of fatty liver which is now becoming alarmingly high because we see a number of cases of non alcoholic fatty liver disease increasing. The main reason for the non-alcoholic fatty liver these days is complete change in the lifestyle that we are leading today from what was earlier, say about a couple of decades or 3 decades ago. With more and more urbanization happening, white collar jobs, and people leading sedentary lifestyles, sitting at the desk all day, not exercising. Added to that is the social media, the internet, the mobile phones, the laptops, and iPads. So they are constantly only doing what is known as mental work. There is hardly any movement on the physical side. And of course, unhealthy patterns of eating, long hours of eating. These can all contribute towards a fatty liver. And you will see that many of our people, I have seen in my practice, many of my patients who go for annual health checkups come back with an incidental finding of a fatty liver grade 1 in their ultrasound. So this is typically because of the metabolic syndrome that is building up. So sedentary lifestyle, obesity, insulin resistance, leading to high blood pressure, high cholesterol, and finally high blood sugar. And this is the vortex that the patient starts moving in. And then when he starts taking statins, unfortunately, they may not correct the fatty liver sometimes if the predisposing factors are not taken care of. Contrarily, something which is very paradoxically, sometimes people living even healthy lifestyles, so healthy dietary patterns or maybe even exercising, still experience fatty liver, or it shows up in their ultrasound. And in such cases, we know that it's a genetic predisposition or maybe stress, because we know that stress is one of the major precursors of all metabolic and cardiovascular issues these days. So, how can homeopathy help here? Allopathy or conventional medicine does not have much to offer except maybe statins and certain liver supportive medicines. But can fatty liver be reversed? It can be if it is in stage 1 or grade 1, and with the right constitutional homeopathic remedy, which aims at helping your liver get back to normal through a natural healing process. Fatty liver grade 1 can definitely be reversed. Of course, no amount of medication or no kind of counseling is going to help unless the patient starts helping himself with a healthier lifestyle. A homeopath is not going to treat the liver but treats the person with a damaged liver. And how does that happen? When individualized homeopathy is given, it is based on the entire constitution of the patient, his physical, mental, emotional makeup, his lifestyle, his surroundings, and his environment, his relationships, whether they are causing him any kind of stress. And all these factors taken together, a constitutional profile is made, and the remedy that most closely matches the patient's constitution is administered, which works with his defense mechanism to produce the desired effect. Also, homeopathy has additional medicines which have a special affinity to the liver and the mucous membrane of the liver, especially to the tract. And it can these specific remedies which we use very often in homeopathy also sometimes work as constitutional and specific organ specific remedies. These are called, some of them are bryonia, lycopodium, phosphorus, acid phosphoricum, chelidonium, cheonanthus, and several others. The homeopath is going to pick the right one which most suits your constitution, which will help the liver come back on track. But friends, do not ignore this, because fatty liver grade 1 is also a red flag. And it means that if you do not take the corrective steps at the right time, it may proceed to grade 2 or even grade 3, which is irreversible. And once the liver is completely damaged, there is no other option except liver transplant. So please, and of course, if the liver is damaged, then the heart, the kidneys, and the brain also follow suit, because everything works in tandem. So friends, please keep an eye out for fatty liver, and remember that a healthy liver depends on mainly one factor, the liver. Thank you.